Hey there. My name's Frank Miller. I served in Vietnam from '68 to '70 as a combat medic. Saw things no young man should see. Did things I still can't talk about. But you know what keeps me up at night now, 50 years later? It's not the memories of war. It's the simple question I never asked my doctor 6 years ago. A question that might have saved me from 3 surgeries, 18 months of pain, and nearly losing my left leg. I was too proud, too stubborn too. Afraid to speak up during that 15-minute appointment. And I paid for it. Boy, did I pay for it. Today, I want to share my story so you don't make the same mistake. It started with a routine checkup back in 2017. I was 71 then, still working part-time at the hardware store, still mowing my own lawn. Had some pain in my left knee, but hey, what Vietnam vet doesn't have aches and pains, right? We're not exactly known for taking care of ourselves. So I'm sitting there in the examination room, and Dr. Patterson, good doctor, always busy, comes in looking at his computer screen more than at me. He asks the usual questions. How are you feeling? Any changes in medications? Sleeping okay, and I give the usual answers. Fine. No. Yes, the same dance we'd been doing. For years. He notices me wince when I shift on the examination table, and he asks, "Something bothering you today, Frank?" And here's where I made my mistake. I downplayed it. Just the knee acting up again, doc. Probably the weather changing. He nodded, made a note in my chart and said, "Well, at your age, some joint pain is expected. Let's keep an eye on it. Take some over-the-counter pain relievers if it bothers you too much." And that was it. 15 minutes in, 15 minutes out. Prescription refilled. See you in 6 months. What I didn't tell him was that this pain was different. It had started waking me up at night. I'd found a small red spot behind my knee that seemed to be getting darker. I'd been having chills on and off for a week. But I didn't mention any of that. Because I'm a Vietnam vet, damn it. We don't complain about pain. We endure it. 2 weeks later, I couldn't get out of bed. My knee had swollen to twice its normal size, and the red spot had become a dark, angry patch that was hot to the touch. My wife called an ambulance, and she found me delirious with fever. Turns out I had a serious infection that had started in a small cut behind my knee, probably got it working in the garden. By the time I reached the hospital, the infection had spread into the joint and surrounding tissue. The doctors told me later that if I'd waited another day or two, I might have lost my leg. Might have lost my life. I spent 3 weeks in the hospital. Had my first surgery to clean out the infection. Then a second one when the infection came back. Then a third to repair the damage to my knee joint. 18 months of my life. Physical therapy 3 times a week. Learning to walk again at 72 years old. All because I didn't speak up during that 15-minute appointment. So what was that question I should have asked? It wasn't complicated. It wasn't medical jargon. It was simply, "Doctor, could this be something serious I should worry about?" That's it. 8 words that might have changed everything. See, doctors are trained to respond to direct questions. They're busy people with packed schedules, seeing 30, 40 patients a day. If you don't flag something as important, they might not catch it. When I finally talked to Dr. Patterson months later during my recovery, I asked him, "Would you have done anything differently if I'd told you about the red spot and the chills?" His answer haunts me to this day. "Frank," he said, looking me straight in the eyes for maybe the first time in all our appointments, "I would have admitted you to the hospital that same day." That's when it hit me. How much unnecessary suffering I'd put myself and my family through because I was too proud to speak up, to ask that one simple question. Now, I know I'm not alone in this, especially among my fellow vets. We were trained to push through pain, to put the mission above our own needs. Pain is weakness leaving the body, they told us. Well, turns out pain is also your body's warning system, and ignoring it doesn't make you tough, it makes you foolish. But it's not just veterans. I've talked to so many seniors who do exactly what I did. We minimize our symptoms because we don't want to be a burden. We fear being seen as complainers or hypochondriacs. We worry about medical costs and additional tests. We don't want to hear bad news. And sometimes, we're just intimidated by the whole medical system. My buddy Carl, another Vietnam vet, ignored chest pain for 3 days because he didn't want to bother anyone. Ended up having a massive heart attack. Survived, thankfully, but now he's living with half a working heart. My sister-in-law, Janet, never mentioned her increasing memory, lapses to her doctor, because she was afraid of an Alzheimer's diagnosis. By the time they caught it, it turned out to be a treatable vitamin deficiency, but she'd already lost her driver's license and a year of independence. After my experience, I developed what I call my doctor visit battle plan. Old habits die hard, and military metaphors still work for me. Maybe they'll help you too. First, reconnaissance. Before your appointment, write down everything that's bothering you, no matter how small. That red spot. Write it down. Those night sweats. On the list. The fact that your balance isn't what it used to be. Document it. Second, prioritize your intel. Circle the top 3 concerns you absolutely must discuss. Your appointment might be short, so you need to know what's most important. Third, bring reinforcements. Take your spouse or an adult child or a friend. Having another person in the room not only helps you remember what the doctor says, but they can also speak up if they see you downplaying your symptoms. Fourth, ask direct questions. Is this normal? Should I be concerned about this? What's the worst this could be? What tests would tell us more? And fifth, and this was the hardest for me, admit when you're scared. It's okay to say, "Doc, this has me worried." Fear isn't weakness, it's human. Now I know what some of you are thinking. But Frank, my doctor is always rushed. They don't have time for all my questions. And you know what? That's not your problem. That's their problem. Your health is your responsibility, and getting answers is your right. After my recovery, I switched doctors. Found one who specialized in geriatric medicine. That's fancy talk for old folks' problems. First appointment, doctor. Ramirez sat down, put her computer aside and said, "Mr. Miller, tell me what's on your mind today." "We have 20 minutes, and this time is all yours." I nearly fell off the examination table. 20 whole minutes. All mine. It was like being seen as a person, not just another Medicare number to process. And you know what? Those 20 minutes probably saved the healthcare system thousands of dollars in prevented complications and hospitalizations. So if your doctor won't give you the time you need, find one who will. I know that's not always easy with insurance restrictions and doctor shortages in some areas. But your health is worth fighting for. Let me share the checklist I use now for every medical appointment. Feel free to steal it, I sure. Wish I'd had it 6 years ago. 1 week before the appointment, start a symptom diary. Note when problems occur, what makes them better or worse. List all medications, including over-the-counter stuff and supplements. Write down all questions, no matter how small or embarrassing. The day before, prioritize your concerns, star the top 3. Arrange for someone to go with you if possible. Prepare a short, clear description of any new problems. During the appointment, start with your biggest concern, not small talk. Be specific about symptoms. My knee pain is a 7 out of 10, worse in the morning and has been increasing for 3 weeks, not just my knee hurts. Ask directly, should I be concerned about this? If you don't understand something, say so. Could you explain that in simpler terms? Before leaving, ask, is there anything else I should watch for or be concerned about? After the appointment, write down what the doctor told you while it's fresh in your mind. Schedule any follow-up appointments immediately. Set reminders for taking new medications. This system works. It's saved me from at least 2 potential complications since my knee ordeal. Now let's talk about red flags, situations where you absolutely must speak up and be insistent about getting care. For me, the red flags I ignored were fever with a joint problem, increasing pain rather than decreasing pain, redness and warmth around a joint, chills, and night sweats. These are signs of infection, and infections don't get better on their own. Other red flags that should trigger immediate questions include sudden, severe headaches, chest pain or pressure difficulty breathing, confusion or personality changes, unexplained weight loss, blood where it shouldn't be, in stool, urine, or when coughing if your doctor seems to dismiss these concerns. Don't leave that office until you get answers. Be polite but firm. Doctor, I'm really worried about this symptom, and I need to understand what could be causing it and what we should do about it. Remember, you're not being difficult. You're being your own advocate. And sometimes, that makes all the difference between catching something early and, well, ending up like I did, with 3 surgeries and 18 months of pain. Let's talk about something that doesn't get discussed enough, the mental game of doctor visits. For many of us, especially us older folks, especially veterans, there's a whole psychological battle happening when we step into that examination room. There's the power dynamic. The doctor is the expert in the white coat. We're vulnerable, often literally exposed in those flimsy gowns. There's the fear. What if they find something terrible? Sometimes not knowing feels safer than knowing. There's the shame. Will they judge me for not taking better care of myself? For gaining weight? For still smoking? And for veterans specifically, there's often a deep-seated resistance to admitting weakness or needing help. We were trained to be self-reliant, to push through pain. Asking for help feels like failure. I had to unlearn 50 years of toughing it out to become an effective patient. And it didn't happen overnight. What helped me was reframing how I thought about medical appointments. This isn't about being weak or strong. It's about being smart, strategic. In Vietnam, did we charge blindly into the jungle without intel? No. We gathered information, assessed threats, made plans. That's all I'm doing now with my health, gathering intel, assessing threats, making plans. Doctor visits aren't surrendering. They're tactical advantages in the fight to stay healthy. One of the most meaningful things I've done since my recovery is helping other veterans, and really anyone who will listen, prepare better for their medical appointments. I volunteer at the VA hospital now, talking to vets about how to communicate effectively with their doctors. The younger guys get it immediately. The ones my age, well, they're stubborn, just like I was. But some of them listen. I tell them my story. Show them my knee, with its impressive battle scars. And then I ask them, What question aren't you asking your doctor right now? What are you hiding because you don't want to seem weak? The answers I hear would break your heart. I've been having chest pains for 6 months. I can't feel my feet anymore. I think I might be depressed, but real men don't get depressed. I can't remember things like I used to. These are all things that can be treated, managed, improved, but only if they're spoken aloud, only if that critical question gets asked. Doctor, should I be concerned about this? So I help them practice. Literally, role-play the appointment. I play the doctor. They practice speaking up. Sounds silly, but it works. Rehearsing tough conversations makes the real ones easier. So here we are. I've told you my story, how one unasked question cost me dearly. How pride and stoicism nearly cost me my leg. And what I've learned since then about being my own medical advocate. If there's one thing I want you to take from this, it's this. Your doctor, no matter how good they are, isn't a mind reader. They don't know what you're not telling them. They can't treat what they don't know about. That question I should have asked, Doctor, could this be something serious I should worry about, is now the first question I ask about any new symptom. And you know what? Sometimes the answer is no, this is normal aging, and that's great. Peace of mind is worth a lot. But sometimes the answer is, yes, we should look into this further. And that early intervention has saved me from who knows what future complications. I'm 77 now. Still have all my limbs, though that left knee reminds me of my mistake every time it rains. I'm still independent, still living in my own home with my wife of 53 years. Still have a lot of living to do. And I plan to do it as an informed, prepared vocal patient who's not afraid to ask questions, even the scary ones. So before your next doctor's appointment, remember old Frank's story. Take time to prepare. Bring your list. Ask your questions. Speak your concerns out loud. Because the question you don't ask could be the one that matters most. This is Frank Miller, signing off. Take care of yourselves and each other. And remember, in the doctor's office, silence isn't golden, it's potentially dangerous.